Finding an eating disorder therapist is really hard. Anyone can say that they treat eating disorders, so how do you know who to trust? These are the questions that I would ask if I was looking for eating disorder treatment for my loved one, as someone who's treated eating disorders for nearly a decade across inpatient psychiatric, residential, and outpatient levels of care. My name's Jennifer Lancaster. You can call me Jen, and I'm a licensed clinical social worker and supervisor, as well as the founder of Houston Healing Collective, a group therapy practice that specializes in trauma and eating disorders. The first question is, do they truly specialize in eating disorders? This seems obvious, but it's worth asking directly. A generalist therapist with good intentions is not the same as someone who's dedicated their clinical work to treating this population. Ask them, what percentage of your clients have eating disorders? What trainings have you completed? What approaches do you use and why? If they hesitate or speak in generalities, that tells you something. The next question is, do they understand the connection between trauma and eating disorders? I feel really strongly about this one. The research shows that trauma and eating disorders are often deeply connected. And there's a difference between trauma-informed care, which you'll hear a lot, and actual trauma treatment. A good eating disorder therapist should be able to speak to the connection between these two things and name the specific trauma treatment modalities that they use. If a therapist is only focused on food and behaviors and not what's driving it underneath, you're likely to feel stuck going in circles. The next question is, how will the therapist actually help you rebuild your relationship with food and your body? Traditional approaches like CBT and DBT are really valuable. They help you understand your thoughts and your behaviors and teach you new coping skills. I use these as a foundation in my own work, but I've come to understand that they're just that, a foundation to build from, not a place to stop. Eating disorders don't just live in your thoughts and behaviors. They're about your relationship with food, with your body, and with yourself. And so your treatment can't just be from the neck up. Ask the therapist how they work with the body, not just the mind. Do they offer somatic approaches, EMDR, or yoga? And ask them what recovery looks like, because recovery shouldn't just be about changing behaviors. It should be about feeling at home in your own skin again, or maybe for the first time ever. How they answer these questions will help you understand if they're seeing you as a whole person or just looking at your symptoms. Finding the right eating disorder therapist takes time, and it's okay to ask these questions before committing. A good therapist understands that the therapeutic relationship is everything, and that relationship needs to start with trust. If you're in Houston or anywhere in Texas, and you're looking for eating disorder therapy that goes beyond the basics, we'd love to connect. We offer a free 15-minute consultation call, and I'll drop the link in the description below.